Hey, Dr. Lindsey and Wendy here. We're going to take you through a little beard transplant. And so we got, 5 or 10 videos on doing mustaches and a couple on
scars on the face,
and a couple on eyebrows. And essentially the technique's all the same. And which means, let me get the thing I draw for the patient.
Yes.
When you plant hair in the scalp, the hair shaft comes out somewhere between 30 and 70 degrees with respect to the plane of the scalp. And just like a tree, the root bulb's down here, and there's lots of dirt or dermis and skin overlying that, so there's plenty of place for blood vessels to grow in. When you're doing an eyebrow or a mustache or a beard, just go look in the mirror, guys or ladies, at your eyebrows, and those hairs come out almost flat with respect to your skin. And so you have to plant those things with not much dirt or dermis over top of them, and so that makes it a little less likely that a tree or a hair is going to grow well. And there's just not a lot of safety margin, and you got to get them angled as flat as you can. And even when you do that, because the body's healing, there's some contractile forces, and these hairs tend to come up a little bit. And so you just got to know that up front. We try to beat that into all of our potential patients before they do it. And the ones that got done someplace else who are unhappy, we ask them whether they were told that, and they say no. Well, who knows whether that was true or not. So you got to lay them flat. Then the other issue is usually those beard hairs that guys have are much thicker than their scalp hairs. And so, you get some of these guys that have really thick beards. I can think of some army dude that we had. I mean, his beard, you could do pull-ups on, but he's got like
very thin hair,
and his hair's much thinner than yours, and so it just wouldn't be a match. And so you got to know up front whether you're matching oranges to oranges or bananas to apples, and make sure the hair quality matches.
So it matches?
Yeah. So once you get past that, then the idea is we can't have a straight line. I mean, some of these guys get SMP'd on their beards, or they trim it so that it looks just like a perfect line. As in a lot of my videos, God didn't make straight lines, which is why those straight hairlines you see on some politicians and some famous people look so goofy. You got to have an irregular line. Put your head over there, Wendy. Walk over there. It's got to be an irregular line so that it looks like it came from nature.
Yeah, you haven't worked on me on my hair.
Right. Yeah. And so here's this 28-year-old Latino boy with thick, beefy grafts or donor hair to work with before, and he and I outlined this kind of irregular pattern to fill in some spots that he
it was splotchy.
Yeah. Now I told him up front, when I was 28, I tried to grow a mustache and it looked like a football team, 9 guys on each side or 11 guys on each side.
So
but I was out skiing a couple weeks ago and I grew a beard and I'm still splotchy. So I think that at some point you can pull the trigger and put some hair in a beard. And so yesterday, and then the last thing I want to bring up is that back here, hair grows in follicular units, 1s, 2s, and 3s, and in all the people we've seen, all we've seen is singles up front. And so take a look at this kid's before picture, kind of what we did the design, and then take a look at his donor region, and that is awesome hair to work with.
Yeah,
and it's all 2s and 3s and a couple of 4s, which I'm highlighting right now. And so then here's a picture of his FUE graft that we FUE'd out. Here's a 2 and a 3. Lots of dirt or dermis and fat around that root. That thing should grow well. In fact, it's almost too big to fit in that slanted hole that we put in.
It was, yeah.
And for a beard like that, we sliver those into 1 hair sections because you don't want a 3-haired whisker.
You took pictures of it very close, so you can see that it grows 1 at a time.
Yeah.
Unless you're Middle Eastern, you grow 3.
Yeah.
You got a big one.
And then here he is with the holes made, and it's hard to see, and then here he is at the end of the case. And just like with hair, on the scalp, there's a little bit of dermis sticking up. So again, what you're seeing is just this little bit right here. And that's that stuff. And so, you know, they're not sewn in just like the ones on the scalp. And so we're real uptight not to touch it or sleep on your cheeks for about a week. And we did him yesterday, and he will come tomorrow for his first cleaning. And we'll show him how to gently clean his cheeks. And we'll tell him not to shave probably for 2 weeks.
2 weeks, yeah.
And then it'll fall out, and there'll be a little shock loss of their surrounding whiskers. And hopefully in about 4 months they'll start growing. And hopefully we'll get a picture of them in 13 months.
Yes.
And then the last thing on this video is, you know, if you guys watch a lot of our videos, you know, FUE is so unpredictable. That's what the U stands for in FUE is effing unpredictable extractions. And, you know, we had this kid, and I think we pulled like 300 hairs and we missed 3. I mean, they came out because the tissue around his root balls was just so strong. I mean, it was, and then we hit a certain patch of his head and it changed. And there was...
yes, I was like, oh my God, we should just do FUE. This looks great. And then we get to one little patch where the texture changes. Yeah.
And then a week ago, we did a black guy that we worked on before. And same thing. I mean, his hair came out like...
Easy.
Like any moron could have pulled those hairs out. And then you know, you did get a couple of those. And then the next one we get will be a perfectly straight-haired guy. And the roots just won't survive as well. So... FUE is unpredictable, and make sure you know the pros and cons and talk it over with your doctor before you sign up for surgery. If we can help you, give us a call.
Can I add something?